Hello, everyone. So today's video is going to discuss how the COVID vaccination might impact on pregnancy and whether or not it's safe to take the vaccination during pregnancy. Here with me today is Garima. Garima, would you like to introduce yourself?
Hi, everybody. I'm Garima. I'm the consultant gynecologist and lead for the fertility services at Homerton. And I do get a cohort of patients who are trying for a baby.
Are you safe to have the COVID vaccination whilst you're pregnant?
Uh, I think I would like to answer this question in two parts. One of this is that the vaccines are actually the RNA vaccine, and the experience with this kind of vaccine has been in previous illnesses, etc., like whooping cough, diphtheria, etc. And women are allowed to take that vaccines while they are pregnant. So that is one sort of evidence. The other real-time data comes from the US, where 100,000 women have been injected with the Pfizer vaccine, and there are no red flags at all. It seems to be working fine for the pregnant women, and it does seem to cut down the risk of the severe problems in women. So I would encourage that if you have any questions, please speak to your healthcare workers. As far as I'm concerned, I would encourage everybody to consider taking a vaccine during pregnancy.
Great. And what about after pregnancy? What about when you're breastfeeding? Should people feel comfortable to have a vaccine then?
I think absolutely. One of the things about the breastfeeding is for all the ladies who are planning a pregnancy or who are currently pregnant, is lots of the immunity is transferred to the baby through the breast milk. So when you are injected, it's not the COVID vaccine particles that are transferred to the baby. It is actually the protection layer, the antibodies that are transferred through the breast milk. So indirectly through the vaccine, you're protecting the baby as well.
Great. And what about if you have your first vaccination and then you fall pregnant? Can you continue with your vaccination as scheduled for your second dose?
Okay, so again, from the real life data from the US, there doesn't seem to be any problem. But I do understand people's anxiety in first trimester when you are kind of very early pregnant. If I do this, will something wrong happen to the baby or will I miscarry, etc. So I do understand anxieties from the ladies. And I would suggest that, first of all, speak to your healthcare worker. And if you are anxious that this is the time when the baby is being formed inside your womb and you want to delay it till 13 weeks, that's absolutely fine. Now, what we have seen in the real world, again, is that if you have COVID, later on in the pregnancy, it is much more severe, and your chances of having a preterm labor is much more common if you have it later on in the pregnancy. So if you are protected from 13, 14 weeks onwards, I think that's a good thing.
And is there any guidance around which type of vaccine you should be taking, whether you can have a choice of vaccines?
So recently in the United Kingdom, not because the AZ vaccine is not safe in the pregnancy, but because the study that was said in US was on the Pfizer and the Moderna vaccine. That's why all the pregnant women are advised to have Pfizer at the moment. And I think as we go ahead with time, there'll be more data available that women can have choices which one they want to. But at the moment, it's Pfizer for the pregnant women.
What effects might these women expect to have having had the vaccine during their pregnancy?
So, if your question is about the side effects of the
Yes.
vaccine, then the usual which you have with any vaccine like flu, etc. So it might be a sore arm, you might feel chills or rigors or the muscle aches, but they're all very self-limiting. So you would expect that they will go away entirely in 48 hours time. Now, the second part of the question, I think that I should address in this one is that what benefit are you getting from the vaccine? So what we have seen that women who are vaccinated, their chances of getting the severe disease is lesser. Also, the chances, if you have a severe disease, you would need much more of a respiratory support, and your chances of getting admitted to the ITU is much more. Your chances of having a preterm birth is twice as likely. So if you have a vaccine that it protects from all these side effects, also if you are vaccinated, it also is protecting the other people from that. Maybe also just to mention here is the being vaccination is not 100% guarantee, although it's brilliant what it is showing, but still all the pregnant women, especially after 28 weeks of pregnancy, please remember face, space, and hand washing. So please use your mask, have that 2 feet distance, and please wash your hands.
And sort of the last question I think that's quite common is around why pregnancy isn't being prioritised as one of the first vaccination groups.
I think the reason for that is that your chances of having the infection is similar to anybody else. However, if you are pregnant and are in the high risk group, so if your BMI is more than 40, or if you're diabetic, or if you have a high blood pressure, or any underlying serious health conditions, then you should be prioritized. Otherwise, you are being called as according to the age cohorts. And I'm really pleased today, I heard in the news that people who are about 30, 31 years of age are being called in the United Kingdom. So I'm expecting everybody who is in the childbearing cohort is going to be called very soon.
Great, wonderful. Well, thank you for your time, Garima. I think that's all the questions for me. Is there anything else you want to?
Just one thing, that if you have any concerns about the vaccine, I think you should always go to your healthcare professionals or the GPs and have that discussion. The only way I think we can protect ourselves and the people around us seems to be the vaccine. And I say it from looking in the hospital that how the ITU admissions and how the deaths have declined. But I do understand people's anxiety around it. So please have that conversation with people around you who might be able to help you further. And good luck and many thanks, and good luck with your pregnancy.